Hi, I'm Dr. James Amos, staff psychiatrist at University Hospital in Iowa City, and I'm here in beautiful downtown Indianapolis, Indiana, for the second annual conference of the American Delirium Society. I attended the second day of the conference here on June 4th, and it was a very exciting meeting. The theme of the meeting is a 21st century delirium care roadmap to protect our brains. And I want to emphasize that the whole point of a conference like this is to improve care for patients and to provide high quality medical care in order to manage delirium and to prevent delirium in the first place. So the the second day of the conference was taken up in a couple of sessions in the morning, one of them about the pathophysiology and biomarkers of delirium. And there were very many speakers, and one of them was President-elect Dr. Malas Bustani, and he talked about biomarkers for delirium in the ICU. Dr. Alasdair MacLelach, another luminary in delirium research, who is the current president of the European Delirium Association, talked about cerebrospinal fluid biomarkers of delirium. Those are just highlights. I was not able to attend every meeting, of course. I did attend the delirium measurement session, which was, by the way, moderated by the University of Iowa's own Dr. Michelle Weckman, MD. And just to give you an idea of what you may be missing and to help you consider whether or not you want to become a member of the American Delirium Society, the titles of the meeting, the titles of the talks, rather, were Phenomenology and Core Domains of Delirium Studied Using the DRS R98. Of course, that would mean that Dr. Paula Trepaz was talking. There was a talk about delirium screening and measurement in the general hospital population by Dr. Goudreau, talking, of course, about the new desk, very short and simple screen for nurses to use. And also talk by Oncology Nursing Delirium Screening Program by Laura Hoofring, who's a master's in nursing at Johns Hopkins. The keynote speaker was Dr. Sharon Inouye, who talked about the future of delirium research. And I thought the most interesting part about this was Dr. Sharon Inouye's vision about how does the American Delirium Society partner with other organizations to define what delirium is and what delirium is not, and to further characterize other aspects of delirium, including hypoactive versus hyperactive delirium. The afternoon session was taken up by different discussions about postoperative delirium, and I thought that one of the very interesting talks was Thomas Robinson, who was at the University of Colorado at Denver, and the title of his talk was The Effect of Baseline Cognition on Postoperative Outcomes. And he frankly acknowledged that surgeons don't typically evaluate cognition preoperatively as a predictor of outcomes after surgeries. And you'll never guess what he uses, or what he used in the study of this type. And it was the mini-cog, and I use the mini-cog every day as a psychiatric consultant in my hospital as a way to increase the sensitivity of the confusion assessment method, or the CAM, developed by Dr. Sharon Inouye. So it was very gratifying to see that a tool that I use every day and I'm very familiar with is now being investigated by surgeons to investigate preoperative cognitive impairment, which may predict delirium and poor outcomes postoperatively. So there's a lot going on with the American Delirium Society, and this was just one day in the American Delirium Society's meeting, and next year's meeting promises to be even bigger. And Dr. Malas Bustani, the president-elect, and Dr. Jim Rudolph, current president of the American Delirium Society, are seeking to increase the membership of the American Delirium Society by 25% and to increase attendance at the conference by 25% as well. And I think that it's very likely that membership will probably increase by much more than that, given the quality of this year's meeting at the Omni in Indianapolis, Indiana. Well, you can go to my blog site at jajsamos.wordpress.com, or the Practical Psychosomaticist, to find out a little bit more about what's been happening at this 3-day meeting, because I'll be writing about it as well. Thanks for listening, and hope you're considering becoming a member of the American Delirium Society. It's made up not just of psychiatrists, of course, but of intensivists, nurses, and other professionals and stakeholders, with the goal of providing high-quality medical care and improving the recognition, treatment, and prevention of delirium. Thanks very much.
I thought